My name is Abiju Clark and I'm here with Cindy McCartney playing as my patient today. I'm just going to perform a head, eyes, ears, neck, and throat assessment. This assessment includes inspection and palpation as techniques. So I've already gathered my supplies, I've prepared the environment already, making sure it's clean, and prepared my client already. So I'm going to go ahead and provide the room with privacy. I'm going to wash my hands. Good day, sir. How are you?
I'm good.
I am student nurse Clark. Can you remind me of your name again?
Sydney McCartney.
Alright. Good day, Mr. McCartney. How are you feeling right now?
Good.
Good. Alright. I'm just here to perform a head, eyes, ears, neck, and throat assessment. Is that fine with you?
That's fine.
Alright, great. So this should only take about 15 minutes, and it's just to assess any abnormalities with you, alright?
Okay.
So as I'm looking at the head, it is normal cephalic, nice and round. There's no cuts or lesions on the face. The head is symmetric, and the facial hair is evenly distributed. I don't see any swelling or lumps across the face. So bend your head for me. So I'm just inspecting the hair for color. It is black, and any cuts or lesions on the scalp, any masses, any lumps. I'm looking for any excessive hair loss, and then I'm gonna see if the patient have any hair lice across the skin. I don't notice any, so I can go ahead and palpate with my fingers. So as I palpate his head, I'm feeling for any lumps and checking to see if it's tender. Do you feel any tender as I touch?
No.
Okay, so my patient is fine, so he's perfectly fine with the head. So now I'm going to assess the temperature using the dorsal side of my hand. And it should be evenly warm across the face. So then I can go ahead and assess the frontal and maxillary sinus, checking for tenderness. Do you feel any tender as I press on there?
No.
And the maxillary, any tender?
No.
So the frontal and maxillary sinus are non-tender. So I can go ahead and assess cranial nerve 5 and 7. That's the facial and sensory nerves. So I'm going to use a sharp and dull object that will be my cotton ball and my hairpin. So when I assess on 5 points on the face, and you can tell me when you feel sharp or dull, okay?
Okay.
So close your eyes for me.
Sharp. Dull. Sharp. Dull. Sharp. Dull.
Okay. So his sensory nerves are intact, and I'm going to ask him to perform a few facial expressions to assess his facial nerves. Frown for me. So as you see that he's able to frown without any hesitance. Smile for me. So as you look, you're looking at the nasal labial fold. It should be symmetric, and one should not be up, one should not be down. If it is up or down, it just indicates a sign of stroke. So he's perfectly fine. So clench your teeth for me. So this is assessing the muscles, the strength in his mouth, making sure he's able to clench his teeth without any hesitancy. He's able to move them. Thank you. So that's it for the assess for cranial nerve 5 and 7. So now I can go into the nose and look at the symmetry of the nose, making sure it's midline and it's no swelling, it's symmetric, and there's no cuts or abrasions on his nose, so there's no skin discoloration, there's no drying or any lumps. So I can also palpate and feel for any lumps or any tenderness above the bridge of the nose. Do you feel any?
No.
Okay, great. So I'm going to put on my gloves. I'm going to also put on my gloves now. And this is for the internal part of his nose. But before I get into that, I'm going to look at, still assessing the external part of his nose. So I'm going to assess for nasal patency. And he's going to occlude one nostril for me. And then you're going to breathe in and out through the mouth. And you can do the same for the other. So with this, you're testing for nasal patency, making sure there's smooth airflow in and out of his nostrils, and making sure he does not have no blockage. And I'm looking to see if there's any discharge, any visible discharge or any bleeding from his nose. So with this, now I'm going to use my pen light. I'm going to use my pen light. Pull your head up for me. And I'm going to look inside his nose and I'm looking for any discharge from them, and I'm looking at the nasal cavity, making sure it's moist, and I'm looking at the nasal septum in both nostrils to make sure it is not swollen, and you're looking at the turbinates inside the nostril to making sure they're not inflamed either. So now that's a part of the nose is fine. So I'm moving on to the mouth, making sure the lips is nice and moist. The color is brown. There's no excessive drying and no crackles, no cuts, no swelling. If there's any dryness of the lips, excessive drying of the lips, it indicates that your client is dehydrated. So now I can move inside the mouth. So open your mouth for me. Alright, so I'm using my pen light again, and I'm looking inside the mouth. I'm making sure it is moist and no bleeding and no cavities, and the rooftop is nice and pink. Inside the mouth all over is pink and moist, and there's no cavities. So now I'm going to use my tongue blade, and I'm going to ask him to open his mouth. Stick with your tongue for me, and you're going to say ah. When he's okay. While he's doing that, I'm looking at his uvula, making sure it vibrates as he say ah, and I'm looking at the tonsil, making sure it's not swollen and it's not touching each other, and I haven't noticed that. So as he's doing that, I'm looking at the symmetry of his tongue and the color of his tongue at the same time. Can you stick out your tongue for me? And making sure there's no cuts or abrasions on his tongue, and making sure it's moist and it's nice and pink. So he's gonna move his tongue up, down, left, right. And it's assessing the muscles in his tongue, and I'm going to assess the muscle strength using my tongue blade. And he's going to push against as I push against his tongue, and he's going to do this so to test the strength the strength of muscles in his tongue. So I'm now going to use my gauze to palpate his tongue for any lumps. So good tongue. So as I palpate his tongue, I should feel no lumps. And does it feel tender? And it shouldn't feel tender on his tongue. There should be non-tender. So now that's it for his mouth. Now I'm going to actually turn this way for me. So now I'm inspecting the eyes to look at making sure there's no excessive drooping of the eyelids, and his eyeballs lie perfectly in his eyes, in his eye socket. And looking at his eyelash, making sure it curves upward and outward, and his eyebrows is evenly distributed with hair and it's symmetric, and making sure there's at the lacrimal duct there's no excessive tearing coming from the lacrimal apparatus. So I'm looking at any discharge from the eyes. I'm looking at the color, and the color is brown, and the pupil is nice and round. There's no deviation of the eyes also. So now I'm going to ask him to look up for me. I'm looking at the conjunctiva, looking to make sure it's pink, nice and pink. Look down. I'm looking at the sclera, making sure it's white and no yellowing. Yellowing or sclera indicates the patient have jaundice, and I'm making sure it's nice and moist and with clarity. So that's the external part of the eye. So I'm going to ask my patient to focus his eye on this object over here, the wall. And I'm going to use my pen light and test for light accommodation on the eyes. So I'm shining the light directly on his eyes. So as he focuses his eyes, I'm looking at the pen light to make sure it is at the same point in each eye. And it should be like that. So I'm going to let his eyes focus for a second. So now I'm going to test for pupillary convergence and accommodation. So he's going to focus his eyes on this pen light. I'm going to move it inwards. As I move it in slowly inwards, his pupils should constrict, and as I move it out, it should relax, dilate. So as I do that, I should see both his eyes move inward and outward at the same time with no deviation of it. So now I'm going to use the 6 cardinal points with my pen light, and he's going to follow each point at each point. This is 6 cardinal points of gaze. So follow it. And you want to do this slowly, and this is just testing the motor skills of the eyes, making sure it each goes at 6 points as you use your pen light to follow. Okay? So now I'm going to test the peripheral vision using 2 opaque cards. 2 opaque cards, and with this he's going to occlude one eye for me, and I'm going to occlude the same eye, and it's testing for peripheral vision. Tell me when you see my wiggling fingers.
I see it. I see it. I see it. I see it.
Okay, and you can do the same with the next eye.
See it. See it. See it. See it.
And we should both see my fingers at the same time. So that's just a test for peripheral vision. So now I'm gonna test for light accommodation on pupils using my pen light again. I'm gonna shade this eye and use the pen light, move it in slowly inwards, and the pupil should constrict, and I move it out quickly, and I'm gonna do the same thing with the other eye, and it should constrict. And the acronym PERLA, pupils are equal and react to light accommodation, or round and react to light accommodation. That's like an acronym to use for when you document your findings. So his eye vision is good. So there's numerous tests you can use. And now I'm going to assess the airs. The airs now, it should be symmetric and lie on both sides of the head. Good. And it should not be swollen and it's brown, or there's no visible discharge. And I'm going to go ahead, and there's no cuts, lesions, or scraping on his airs. I'm going to go ahead and palpate his airs. Around the auricle, feel for any tenderness. Any tenderness, sir?
Nope.
And there shouldn't be any lumps around the auricle. Then I'm going to assess the triggers. Palpate the triggers. Make sure to check for any tenderness. Do you feel any?
Nope.
Then I'm going to go to the mastoid process and check for tenderness, or if it's swollen. Do you feel any tenderness there? Okay, so this mastoid process is fine and the trigger is fine. So now I'm going to use my fingers, and I'm going to go on the TMJ joint. That's the temporal mandibular joint on the side of the head, each side of the head. I'm going to ask my patient to move his mouth open and close it for several times. And I'm going to check for capitation with movement, and check if it's swollen and tenderness there. Now I'm going to go inside the ears with my pen light, pull the auricle up and downwards, outwards and downwards, looking for excessive wax and any discharge. So I haven't noticed any of that. So now I can perform the whisper test to make sure his hearing is intact. And ask him to include one ears, repeat 3 words to him, and he can repeat it back to me.
Blue, black, orange.
Include the next ears.
The sky is blue.
Good, so his hearing is intact, so that's it for the ears. You can turn around back for me, sir. Okay, so now we're going on to the neck, and we're also looking for any cuts, lesions, and making sure the neck is symmetric on the head, on the body, and making sure there's no swelling of any lymph nodes around the submental area. And the carotid arteries, there's no excessive pulsation from them. And you want to palpate them one at a time. If you do 2 at a time, it's going to cause obstruction of blood flow. So I'm going to palpate carotid artery, and there should be no swelling, no excessive pulsation of them. You do this for both sides. So I'm using my stethoscope, the bell of my stethoscope, to listen for any brewy sound from the carotid arteries. So I shouldn't hear any sound coming from the carotid, and a normal person, you shouldn't hear any sound coming from them. So I'm going to go ahead and assess for temperature around his neck. It's even across. Then I'm going to palpate for any swollen lymph nodes on the submental area, around the tonsillar area, and behind his neck and around. And there shouldn't be any tenderness or any lumps or any masses. So when I ask him to turn his head, try to use his chin to touch his shoulder to the left and right, and bend your head back and front. This is assessing for range of motion of his neck, and it should be intact. Alright, so I'm going to assess his tonsil and his thyroid gland to make sure it's center and his trachea is center. So I'm going to ask my patient to drink some water, stand behind him, and use posteriorly, and use and he's going to swallow. And the thyroid should move up and down without any hesitance. So now I'm going to assess the supraclavicular area to make sure there's no swollen lymph nodes and there's no tenderness around the supraclavicular area. So now I'm going to remove my gloves, and then I'm going to wash my hands and document. Thank you, sir, for your time and this concludes our assessment. I find that there's no problem with your head, eyes, ears, and neck and throat. Thank you.